How important this is to protect our heroes. That's everything from N95s to masks to surgical gowns, gloves, eyewear, a whole host of things. The good news is there are several categories where we do have enough PPEs to get through the week. And I want to emphasize, when I say enough, that means on the crisis standards we're working with. I want to be very clear to all the healthcare professionals out there, all the first responders. I'm not saying this is the ideal we wish we were dealing with. I'm not saying we have the kind of supplies we're used to when we're in peacetime. But by the crisis standards set by the CDC, we have enough of most items to get through this week ahead for our healthcare workers, for our first responders. There are two areas where we need additional delivery during the week. That's N95s and surgical gowns. We do have orders in. We're reasonably confident about the timeline of that resupply, but we do need it to happen on a timely basis. Let me go over some overall numbers with you now, and I'll start with ventilators. So what's happened so far? In addition to the ventilators that hospitals had, we have delivered 2,865 ventilators to hospitals throughout New York City, in addition to 1,780 BPAP machines. And these are machines that can be very helpful. As I discussed with the CEO of our public hospitals, Dr. Mitch Katz, they are a part of the puzzle. They don't do the same thing that ventilators do, but they can be helpful in dealing with some patients in some ways and relieve some of the pressure on the overall situation in terms of ventilators. That said, we still need the number of ventilators we need in any event. So having distributed those 2,865 ventilators, having now stated that we can get through to Tuesday or Wednesday, what's left? We have 135 ventilators in our reserve. We are holding those for very rapid deployment to where they're needed most around the city. And that obviously can happen in a matter of hours. But that's the entire reserve we have left for all of this city of 8.6 million people. I want to tell you why these ventilators, the supply of ventilators, is so crucial in particular at this moment, because what we're seeing lately is between 200 and 300 more patients needing to be intubated every day lately, just specifically patients related to COVID. We believe at this point, as of this morning, that the approximate real number of patients, COVID patients who are intubated in New York City, we believe that number is actually approaching 4,000 when you add up all the information we have and information that's coming in. And everyone understands this is a rapidly changing situation. We think that number is about 4,000. The math is clear between today, tomorrow, Tuesday. We could add almost 1,000 more in that time frame. That's why we believe we will hit that 5,000 mark in truth on Tuesday or Wednesday. Again, I would love it if it proved that our projections were too cautious. That would be a very good thing. But we are bracing for the reality that that's the number we could hit. It's a staggering number. And remember, for so many of those patients, we've got to fight hard to save their lives. Our healthcare professionals are doing an amazing job, but it's a tough struggle, and a lot of those patients will be hospitalized for many weeks. They could be intubated for 2-3 weeks easily. Once someone needs a ventilator, they need it for as long as they need it, and that's another part of this equation we have to keep in mind. So to get through next week, based on these updated projections, we believe we will need between 1,000 and 1,500 more ventilators for the period roughly Wednesday to Sunday. Again, those dynamics will change daily, hourly even, so we will keep updating the assessment. But that's the plan that we have going into this week, to find 1,000 to 1,500 more throughout the course of this coming week to make sure there's always a ventilator for every patient who needs it. Now, as you see on this chart, this is the whole healthcare system in New York City, and this composites what we're seeing across, I should say, a variety